Hi everybody, I'm Jon-Erik. I am the acupuncturist here at Collective Wellness. I have been in business in Durham as an acupuncturist for, since 2010. And just joined the group here as we opened our doors in this space. So this is the acupuncture clinic room. Normally we set up with a couple of tables, but we've moved some things out so to make sure that everybody's able to come in. Hi Sylvia, come on in. So we're going to do a demo today. Janice here has agreed to be our first patient. So we met earlier this week, actually it was yesterday, and talked a little bit about what's going on with her and what she would like to get out of acupuncture. So Janice, would you mind kind of telling everybody what the main thing we're going to be working on today is?
My knee. I have pain in my knee.
Yeah, so she was telling me yesterday that she's got some intermittent pain in her knee, her left knee, right? And it hurts from time to time. Anything else you'd like to share about that?
No.
Yeah. Okay.
It hurts.
Yeah. So we're going to do some work on her knee. Where did my bolster go? So if you wouldn't mind having a seat on the table and taking off your socks and shoes. So we'll be working on her knee. Pain is one of the things I do the most of, is treating pain. Both people who are having pain right now, as Janice's example, periodic pain. For some people, it's after having an accident or surgery. But this one's a little bit mysterious, right? We're not really sure. It just started happening one day.
Yeah.
Yeah, and kind of like mysterious kinds of things are sort of the water in which I swim. So that's kind of normal day. So let's see. Yeah, come on in. Anybody else Berkeley, you want to scoot in here? Are you good to go? All right. All right, great. So let me tell you a little bit about the way acupuncture works. So everybody's kind of got ideas about, you've seen movies and everybody's a pincushion and it's very mysterious, and you're probably going to see something that looks pretty different here today. So basically, the ancient Taoists discovered that there are 5 main energetic flavors, sort of systems in the body that all work together. And when they're in health, it creates a system of balance, which we call homeostasis. So everything is supporting the systems that, each system is supporting the systems that they're supposed to support, and each system is controlling the system that it's supposed to control. And so it's a little bit of a check and balance system that allows the body to function properly. The other thing that acupuncture does is it makes sure that things are flowing smoothly. So that means blood is circulating properly. It means lymph is circulating properly. It means that energy in the channels, nerve function, everything is able to move smoothly. And so when there is a restriction that can keep the circulation or energy or blood from moving smoothly, that can create pain. And sometimes just having not enough blood and not enough energy, there's just not enough strength in the system. You can think about that like a hose that's got some air in it, and so it's kind of like sputtering. And so that's kind of what's going on with Janice right now. She just doesn't have a whole lot of flow going down through her leg. Things are normally working pretty well, but every once in a while, things just kind of get stuck and that pain shows up. So what we're going to be doing today is we're going to be building some energy, we're going to be moving some energy, and we're going to be doing a little bit of local work in the knee to relieve any restrictions there. All right? Anybody have any questions about that huge information dump I just dropped?
What is Janice's normal pain level with her knee?
Probably from 1 to 10, about a 7 or 8.
So it goes, yeah, it goes from like a 0. Is that right? Like most times, like no pain.
No,
Okay, so a little bit.
about 2 or 3.
About a 2.
A little bit of pain.
Okay, so she's saying that her pain's about a 2 or a 3 normally, and then it'll flare up to 7 at times.
Yes.
Yeah, and
Sorry, what is it today?
It's probably about a 4 or 5. It's working its way up there.
okay, so things are kind of on the upswing. It's about a 4 or 5, and okay. All right, any pain at all in the right knee?
No.
It's perfectly fine.
Perfectly fine.
Okay. And that can happen, right? You can have just the small area of, just right there, there's just a little bit of restriction. We could probably go back in her history and maybe figure out why that this is the place where she's a little bit vulnerable. But it really doesn't matter in terms of the treatment. All we need to do is just make sure that it's actually working right now. Any other questions about that?
Do you do herbal medicine also, or only acupuncture?
That's a great question. I do a little bit of herbal medicine as an adjunct to the acupuncture. But for the most part, the main treatment that I'm doing is acupuncture. And that's different from a lot of acupuncturists. There's a style of acupuncture which is probably the most common in America and China, which is called traditional Chinese medicine, TCM. And that's taught as herbs first and like acupuncture as like an adjunct. What I do is what's called classical Chinese medicine. So I'm doing Chinese medicine as it's described in these ancient texts, the Huangdi Neijing especially, some Shanghanlun, some other texts of Chinese medicine. And so my training is all focused on acupuncture. So where a TCM practitioner will split their time between acupuncture and herbs, that same amount of training I'm doing all acupuncture. And I guess you should say I studied at Zhengdao School of Classical Chinese Medicine. It's one of 2 acupuncture schools in North Carolina. I go up there, I'm on faculty at the school, I supervise at the intern clinic there. It's a 4-year program. The 4th year is a clinical internship. So it's having the general public come in for reduced cost treatments and being seen by a student who are supervised by a licensed acupuncturist. And that would be me in the days that I'm up there. All right. So let's just start the treatment, and if there are any more questions, we can take them as Janice's treatment progresses. So Janice, if you wouldn't mind lying back, so this is a pillow for underneath your head. And I'm going to put a bolster underneath your knees. So if you'll lift your knees up for a moment. And can you lift your ankles up too? Okay. And you can just rest your legs long. And we'll just pull up your pant leg here. I can help you out with that.
Thank you.
You're welcome. Okay. So I'm going to be doing some points on Janice's feet today, so I'm just going to swab her foot. All right. So acupuncture needles are sterile, single-use, FDA regulated medical devices. So they come in a bubble pack. These have all been sterilized at the factory, and this is a little 5-pack of needles. People are worried a lot of the time that the acupuncture needles are going to hurt because you got shots as a kid or as an adult, and they hurt. These needles are extremely small. So these are 0.25 millimeters thick. So you could probably fit a couple of these in the hole of an injection needle. Janice has never had acupuncture before. Can I tell them you're a little bit nervous about the needles? So she's gonna, this is gonna be, we haven't set this up beforehand. She hasn't tried any acupuncture needles. So this is gonna be her honest reaction in this moment, so. All right, so we're gonna start with a point on her knee here. And so Janice, I'm gonna have you take a nice breath in and then just relax it out. And the needle's in. Okay. So do you feel anything?
I felt something when you first put it in.
When it first put it in, could you describe that?
More like a pinch.
A little bit of a pinch?
Mm-hmm.
Uh-huh. And now, what does it feel like?
I can't even tell it's in there.
Can't even tell it's in there. Okay. Pretty common. People, you'll notice like the needle goes in. The guide tube is a little tool that gets used to insert the needle. What it does is it allows me to tap the needle in very quickly. So that outer layer of skin is where a lot of the nerves are. So it's very kind of sensitive. And it's important that your skin is sensitive to let you know if there's going to be any trauma or whatever when you're going through your day. So getting it through that outer layer very quickly. It also stretches the skin, so it goes in really quickly and smoothly, and usually doesn't feel like much of anything. So that was pretty normal, that it would feel like a little pinch. So I'm starting with some points in her knee. She told me that the area of pain is sort of like surrounding her kneecap here yesterday. So the channels that are most affected are the stomach and spleen channels. So the stomach channel runs down here, down here, and the spleen channel runs up here. These are a pair. They're both the earth energy, and kind of makes sense that they would kind of both be vulnerable at the same time. So I'm going to start with just opening up the area here with these needles before I start to move anything particularly through the area. So far, so good?
Great.
Okay. All right. All right, so I've worked a little bit in the area. So opening up the knee, I could give this a little bit longer before I did the rest of the treatment, but we're just going to kind of move along here. So the next thing we're going to do is really get the energy circulating. So how long can you go without eating food? A couple of days. Some people get lightheaded right away, but you can go for a little while without eating food. How long can you go without holding your breath? I can go about 60 seconds and then I start to let go. So, excuse me, my nose is running. Where's my... everything's been moved around. I can go about 60 seconds maybe. It's not very long. So what we're going to do is we're going to start with the lung channel, because that circulation is going to happen from the lungs. So air comes in through the lungs, gets into our bloodstream. It combines with our, well, basically creates ATP in the cells as it gets absorbed in the cells, and that's what our body runs on. So we're going to start working from that area. So I'm going to start with a point on your wrist here. Okay. I just dropped that needle, so I'm just going to start with another one. It's really important to maintain the sterility of the needle, so if it touches anything, it's done. Okay. We'll just let you rest your arm like that. All right. So what I just did was moved energy from the lung channel to the large intestine channel. That circulates up to the face, and now it's going to go down the stomach channel. I've already opened the door here, so circulation can move through that area. So we'll do this point, which will help circulate the energy down the legs. You might feel that one a little bit stronger than the other ones. A little bit, a little bit.
After the first one, I didn't feel anything.
Nothing. Yeah, yeah. So we just put some force behind that one. So that's why she's got a little bit more sensation behind it. So because we're moving the energy through the channels here, it's all kind of adding, and that's why I opened up the door first. So we did that one. I'm just using this point just because it helps just move the energy and blood smoothly through the area. You doing okay?
I'm doing fine.
Okay, great. I'm just going to go ahead and do the points on the other side. Any questions about that, or any questions for Janice?
In general, how long would your session be with Janice or client?
The intake portion, I spend about an hour just the first time someone comes in talking about what's going on with your health. We didn't just talk about your knee, right?
No.
We talked about everything. We talked about diet, sleep, exercise, digestion, reproductive system health. Yeah, I mean, pretty comprehensive. For most people, it's the most comprehensive health intake they'll ever get. So we'll do that, and then that's followed by the first acupuncture treatment. I'll work up an assessment, create a treatment for the first time, and then we'll go ahead and put the needles in that first session. So the whole time takes about an hour and a half to 2 hours for that first session. Yeah. The follow-up sessions are closer to 45 minutes. We'll have a brief conversation about how are things going, any changes since the last time that you came in, and then we get right to the acupuncture.
And then based on what the issue is, would you recommend a certain number of sessions, or would it just be recurring until it resolved? Like how do you determine how many times you'd see her?
It's a great question. How do you determine how many times that somebody comes in? So for an acute condition, something that just happened, like for instance, somebody came to me this week, he has fall allergies and just can't breathe. Sinuses are congested, and it's not something that's constantly a problem. For him, basically one treatment, maybe 2 treatments, and he's good to go. For somebody who's had an issue that they've been dealing with for a number of years, sort of a rule of thumb that I like to give people is for maybe every year that you've dealt with something, it might be a month of treatment. Just everybody's different, and then there's, of course, how many things are we working on? What is your current state of health? For people who are active, healthy, eating well, treatment usually goes really quickly. For people who are just sort of worn down, haven't really been taking care of their bodies, they've been letting things go for a long time and just kind of tolerating it, it might take a little bit longer. And that's what's really great about being here at Collective Wellness is we've got a whole team to really help people kind of accelerate things. Because by the time it's been years and you're finally taking care of it, it's basically become intolerable. So it's really great to be able to have a team of people who are able to really accelerate the process for people. All right, so I'm going to go ahead and put this one on this side. Just turn your hand like that.
Are all the needles the same size?
No, all the needles are not the same size.
And what would determine larger than the 0.25 millimeters?
Okay, so the ones I just used in her hand are a different size than the original ones. Because the hand is so sensitive, I mean, we experience a lot of the world through touch. So many nerves run through the hands, and such a large portion of the brain is responsible for responding to, understanding, perceiving touch through the hands, that it just becomes really uncomfortable to have a big needle go in your hands. So that's actually a 0.2 millimeter needle. So both of those, they're very small. So they're very flexible. They're a little bit harder to work with because of that flexibility. So if I'm working in an area where there's a really tight muscle, that needle may not even go in, it may just bend. So using a little bit thicker gauge needle allows me to go into a muscle and really relieve that stuck tight muscle. Some people have like those little gummy spots in a muscle where it just feels like, you can actually do some really neat things with an acupuncture needle to allow that to let go, allow the circulation to return to that area. Yeah, it's a great question.
And are the points in her wrists the same points that most acupressurists would use?
Yeah. So you could call them acupoints.
Okay.
So I'm using needles in the point. So we call this acupuncture. Mm-hmm. If I was pressing on the points, which I do sometimes, I would call that acupressure. But they're still the same point. Okay. Yeah. Because of the tiny size of the needle, the point location needs to be really, really good with a needle. With a finger, you can kind of miss the area and still get the effect. I also use heat sometimes, which is a technique called moxibustion. And I can show you what that looks like. So this is a tool. It's basically a roll of herbs, which comes in a long stick like this, kind of looks like a cigar, and it burns down over time. And I'm not going to light this today because it's mugwort, and for a lot of people, it's a confusing smell. They think it maybe smells like marijuana or something like that, and let's not confuse or scare anybody off. So, but I'll pass this around if you want to just take a look at it. What I use in colder months especially is this.
Are you applying this to the skin, or you just use it?
So, right, so this is not like you get a cigarette burn kind of thing. So if I were to heat a point, it would look like this. So I'm just holding it about an inch or a half inch away from an acupuncture point and doing a little pecking motion. Yeah. So this one is smokeless moxa. It's charcoal based, and it's got a little bit of the same herb that's in that stick. Works almost as good as the original formula, but it's a little bit harder to use. If you've ever tried to control the flame on a campfire versus a charcoal fire, you know that it takes a long time to get the charcoal going, and then once it's going, you don't have a whole lot of control over, like, you know, making it less hot. So it's just really nice to have both options. And either way, I would vent the room so it's not full of smoke. Yeah. All right. Are you doing okay?
I'm doing fine.
Okay. So normally we would just let her rest for a few minutes. I might put on relaxing music and just let the body do what it's going to do. Thanks for coming. Yeah. I'll just be around for any more questions.